All right, so this is a demo of the dissection of the fetal pig, at least the introduction. And so you'll find your fetal pigs in a sealed bag with preservative. So go ahead and cut the top, and you can drain the preservative. And set your fetal pig on a tray, and you can put the bag, set it down somewhere. And you got strings. You got 2 strings, and for the back 2 legs, you got this little knuckle here, so you can actually use that. So that way the strings won't slide off and potentially squirt some of the preservative into your face. So go ahead and tie, make a nice knot a couple times. Then, once you've done that, you go across like this, take the string, go underneath, and you stretch out the other leg, and you tie again under this joint here. So that way you can keep the string from sliding off of the leg there. Okay, once you've done that, see? And what you can do, if eventually once you start dissecting in, if these get loose, you can simply just take the string and just continue to wrap it as the legs get looser and looser. Do the same thing with the front 2. These now won't have that joint, so you're just gonna have to tie extra tight. Make sure that it's tight. You go around, once again, go underneath, and pull, stretch, and just like that. And you're gonna want to have a partner to help you. That's basically how you do it. Now, for pretty much the entire dissection, we're not going to need the scalpel whatsoever. The scissors should suffice. These will either never use or hardly use. But the forceps and the scissors will give you very accurate cuts, and the length of this side of the scissor is will allow you to prevent you from going too deep, as long as you're picking up with the forceps. So what we're going to want to do is make an incision going down, going around, and making like an upside down U. We don't want to go around a circle like this, but go around the umbilical cord and down. Eventually you're going to want to open this up, and go up and take the jaw and open it up. And so I'm going to show this right now. All right, so you can start just above the umbilical cord and snip, just like that. You see how I'm picking up. As long as you pick up, you will not tear or cut into your viscera. You will not. You never have to worry. You see that? As long as you pick up, you don't have to worry about cutting into the liver or any of your organs. Just like that. Now I'm going to continue to go down, and once again I'm going to not do a circle, but just go straight down on both sides of this umbilical area here. Now you'll notice that you can't fold it over. This is the umbilical vein. This is the umbilical vein, so you can go ahead and just snip that. That way this thing can fold over. Now let's just go ahead and remove all this skin. Either you can fold it over or just remove it. It might just be easier just to remove it. That way you don't have to constantly have one hand holding. Now these are fetal pigs, so the ribs won't be fully developed. They'll still be halfway cartilaginous, and so it won't be extremely difficult to cut through, but you will to some extent have to, you know, there'll be a little bit of a struggle, but there we are, going kind of under the arm there. And this is the diaphragm that I'm sort of cutting right there, diaphragm. And now we'll do the other side. And what we're doing basically is we're just exposing all the viscera. Cut, cut, cut. Here's the diaphragm and the cardiovascular and the pericardium there. And we're just, can you guys all kind of see that there? This is the diaphragm there, kind of cutting close to the peritoneum there, so that way you get this nice diaphragm view that we generally see in the textbook. And once you, then you can go above the back leg and do the same thing. We're cutting into the skin, fat, and muscle. And now we are exposing the abdominal cavity here and the thoracic cavity up here. And this organ right here, this is the diaphragm. This is what separates the abdominal from the thoracic cavity. So now we've sort of opened this up, and if you want to keep this on, closing it at the end of the day, that'll keep your fetal pig preserved for a longer time. Although we do have, you know, you'll have bags and tubs to keep it fresh, but I generally just prefer just to go ahead and remove the skin and all this tissue, just so you're not having to have one or two hands constantly hold it. And that way you can just see it without having to. All right, now let's go down the mouth. Careful, because these pigs have really sharp teeth. Really sharp teeth. So the easiest way is to just do this and cut. Do the same thing, go down the side and cut. Now if I try to open, careful, because again the teeth are right there. You can just do that, and what I'm going to do is I'm going to cut right across the larynx and go across, and that way we can sort of fold this over. So here I go. It's going to be a little tough. There's going to be, you know, you got the mandible. Now you want to take your finger and just kind of feel for the larynx, this little bump. You want to go just above the larynx, but you don't actually want to hit it. So if you can kind of see from the side, there's the base of the tongue there. Base of the tongue is where you want to hit. And if you see this little flap right here, this is your epiglottis. See that little flap at the end of the scissors? There's your epiglottis. So that's the top of the larynx. That's exactly where you want to be. That might be hard to hit on your first try, but you just sort of, and if you, so now if you push this over, this little bump right here, it's the same thing as your Adam's apple. That's what you feel on your neck. Your larynx is going to be right there. And there is and this right here is your epiglottis. So we've cut right at the base of the tongue. Move over. Now we can continue to go down. we can remove all of this tissue here, and that way we're exposing all the thoracic cavity as well. So here we go. Here's the heart, so careful with that. Here's the heart. So here we go. Gonna go ahead. Again, it's gonna be a little tough because you got ribs that you're cutting through, but of course they're not fully developed, so it does make it easier. As long as you pick up, you won't cut into anything that we need to keep. Okay. Here's the pericardium that I've sort of cut into. You see that? Here's the pericardium. So you kind of, just like that. I'm going to go on the other side. And I'll just go ahead and just remove the, okay. And now on the other side here, now careful, you kind of want to pick up and you want to be careful not to cut off the larynx or the trachea, so I'm just really taking my time here. And this particular pig is not injected at all, so you won't see any colorful blood vessels, red, blue, yellow. Although they are there, you just can't see them. It's all pink inside. So what we'll be using these fetal pigs for is to identify and study the organs rather than the blood vessels. Now, the probe is your friend. The probe allows you to scratch and never tear any organ. This here is your larynx. As you scratch away, you never have to worry about when you're using the probe, because it has a blunt end. So you can just scratch away to clean away all this connective tissue here, and your organs just start to appear just by sort of teasing the connective tissue. There's your larynx. Here's your epiglottis. Here's the hard palate. Here's the soft palate. Your trachea is right here. So we're going to definitely have to do a little bit more cleaning, but here's your trachea. Everybody see that? And I don't expect you to be able to do this as quickly as you're seeing here, just because you might be doing it for the first time. But a little bit of practice. So here's the trachea here. You can't really see the cartilaginous rings quite yet, but as you kind of pull some of this tissue away, there you go. Now you can start to see the cartilaginous rings. Here are you got your carotids here, right here on the side here, and your heart. And what you see here, this is the pericardial sac. You see that? That's the pericardium. And you got your lungs. This is the right lung. Sorry, the left lung. And you got your diaphragm right here. And under the diaphragm, you got your liver. This huge organ all the way across is the liver. And if you pick up the liver, just under here, you have your gallbladder. So this little green sac here is the gallbladder. And underneath that is the stomach. This tissue is pretty resilient, so you can play and probe and it won't poke. That's your stomach. This here is the spleen. The spleen on the fetal pig is like a sheet of paper and really long. On the human, it's not so flat and long. It's more in the shape of an egg, but here's your spleen. There's your spleen right there. Only on one side, only on the left side. If you pick this up and you pick this up, you'll find your, kind of little bit of cleaning, you'll find your, anybody? Your pancreas. Looks like a little baby piece of corn. There it is. See that sort of granular tissue right here? That's your pancreas. Very delicate, so you want to be careful with that. It's not like the stomach where you can just kind of probe around. That's your pancreas. Just underneath the stomach there. Now you have your intestines. This here, all of this is your small intestine. This here is your large intestine. And in the fetal pig, this specifically here is the spiral colon, which would be the same as the ascending colon on the in the human. But this is the large intestine. This is the small intestine. And if you can try, here is the left kidney. It's retroperitoneal, which means it's behind the peritoneum. So you have to sort of clean away, and there's your kidney. There's the left kidney, and the other side will be the right kidney. And from the stomach, if you want to follow the small intestine, so here's the stomach here, follow. Here is your pylorus and pyloric sphincter. The first part of the small intestine is your, anybody? This is your? Duodenum. Yes, your duodenum or your duodenum, right there. And then the rest of your small intestine here is your jejunum and ileum. Very nice. Okay, and as we mentioned before, this is your umbilical vein, and this is your urinary bladder. We have to do a little bit more cutting, but the urinary bladder is here, and these are your two umbilical arteries. Right there. How do we tell? How can we tell if this is a male or female? There's a couple of ways. Under the tail here, if there's this little mound, this is the genital papilla, which means that this is a female. This is a female. If there isn't anything there, it's just a male. And if you have this little extra piece of tissue here, this is the genital papilla, then that makes that this is a female. Also, the other way is if you continue to cut down, and you guys will need to continue down and down. Pull this down like this. You're going to find the ovaries, and here's one right here, and here's the other right here. There are your two uterine. There's your uterine horn, uterine tubes, and your two ovaries at the very end. This here is the descending colon. This is the descending colon. This green is the descending colon. And your nares, nostrils, nares, hard palate, soft palate, epiglottis, larynx. If you take your probe and you do this sort of action, that's your nasopharynx, which is this space under here. Nasopharynx, larynx, trachea, and the heart, pericardial sac, lungs, diaphragm, liver, gallbladder again underneath, gallbladder, stomach, duodenum, small intestine, large intestine, kidney, the spleen, and that granular tissue there, that's the pancreas. Urinary bladder, and your umbilical arteries on both sides, umbilical vein there. Genital papilla, that's this right here, genital papilla. Of course, you got the tongue here. And I'm trying to think if there's anything else for that we can see that of course we still have we have vessels, of course, all the vessels, but those are not injected, so we can't see those. And also for past, if you continue to clean, the next tube after the kidney is going to be your right here, this is attached to the kidney, so after the kidneys, the urine drains into your ureters. Ureters, exactly. So this is the left ureter, right here. And the urethra will come out right out of here. Very nice. Very good. Thank you.